You don't become a doctor to bill. You become a doctor to take care of patients. You become a doctor to serve humanity. Ambient intelligence allows for the patient and doctor to be a patient and a doctor, like it used to be.
There's a certain business requirement for a structured note and careful documentation, precise diagnoses, and carefully backed up coding for the business practice of medicine. But ultimately, it's about the patient's story.
If you look at the promise of meaningful use and all the reasons we got into a digital health record, it really was to take better care of the patient. Unfortunately, sometimes we've done that through a barrier, meaning we added a keyboard, we added a computer, and I think that's a key part of why physicians are frustrated.
And I mean, you notice as a patient, you notice that your physician is typing and talking and, yeah, okay, yeah.
Now we can go into the background and just capture all the information you needed, but also maybe more importantly, capture something that was missed. That missed was the patient's story.
There's a device on the wall, and it's listening to your conversation, and it's able to discriminate between a patient and a physician and a family member, and is able to generate a progress note and a patient encounter based on your conversation.
What it has enabled is that I can pay attention to what you are saying, because it is very important for me to have the empathy and you to feel as a patient that you are telling somebody who actually cares about you.
Hey Dragon, start my standard order set for arthritis pain.
The idea of a computer that can listen like in Star Trek and just hear what's going on and make sense of it and slip into the background and listen, but only interject when necessary, that was for a long time a fantasy.
I would say before, in a typical week, I would probably spend 6 to 8 hours documenting, just simply dictating and signing notes. I bet that my time has been cut into half, if not thirds, because of Nuance now.
It takes the hands-on time that the provider has to spend with the computer and puts that time back with the patient.
It really takes a lot of that manual work out of the patient encounter and just allows it to happen kind of naturally.
Ambient puts a listening device in the room quietly, securely, privately, and allows the two people in the room to really have a very intimate discussion on very private things. Knowing that the necessary recording of that for the business of medicine and healthcare can go on in the background, but letting that personal connection continue. And that's the reason I think almost all of us went into healthcare. It's to be able to be there for people, to express caring, to express empathy, and to connect as human beings.